Now we will look into each drug group of the anti-cancer drugs. The alkylating agents are bischloroethylamine, aziridines, triazines, icosaphenate, nitrosourease, and platinum compounds. The drugs are meclorethamine, chlorombucin, cyclophosphamide and melphalan, tiotepa, dacarbazine, procarbazine, busulfan, carmazine, lomustine, somustine, cisplatin, carboplatin, and oxaliplatin. The mechanism of action for alkylating agent, it cross-link the DNA to each other, and the linked DNA unable to complete normal cell replication. So the cell will be arrested at G1 phase or S phase of the cell cycle, and cell undergoes cell death. Platinum compounds has intra-strand and inter-strand cross-linking the DNA, while triazine methylates the DNA and all inhibit DNA synthesis. The routes for alkylating agents are parenteral and oral, and the adverse effects include nausea and vomiting, delayed toxicity of bone marrow suppression, which will represent as leukopenia, thrombocytopenia, and bleeding, nephrotoxicity, and peripheral neuropathy. And nitrosourease is highly lipid soluble, so it can cross the blood-brain barrier and useful for the brain tumor. Okay, the clinical use of meclorethamine are for Hodgkin's and non-Hodgkin's lymphoma, chlorombucil, chronic lymphocytic leukemia and non-Hodgkin's lymphoma, cyclophosphamide, acute and chronic leukemia, non-Hodgkin lymphoma, ovarian, breast cancer, neuroblastoma, immune tumor, melphalan, multiple myeloma, breast ovarian cancer, tiotepa, bladder, breast ovarian cancer, and busulfan CML. So the side effect of these drugs include bone marrow suppression, BMS, hemorrhagic cystitis, especially for cyclophosphamide, and busulfan has been seen to be associated with skin pigmentation, and some of the drugs shows pulmonary fibrosis. Carmazine used in Hodgkin's, non-Hodgkin's lymphoma, primary brain tumor, and melanoma, and will cause BMS. Tretinoin, ovarian cancer, BMS, procarbazine and dacarbazine in Hodgkin's disease, and also have BMS. And the platinum compounds, the cisplatin, carboplatin, and oxaliplatin, used in testicular, ovarian, bladder, esophageal, lung, and colon cancer. And the adverse effects include renal toxicity, ear toxicity, and brain toxicity. Now, the antimetabolites can be divided into folate antagonists, purine antagonists, and pyrimidine antagonists. And we have seen before the methotrexate, the purine, fludarabine, cladribine, and gemcitabine, and 5-fluorouracil and flucytosine. So first we look at the methotrexate. Okay, it inhibit the enzyme dihydrofolate reductase and interrupt the DNA and the RNA and protein formation, and usually act at the S phase of the cell cycle. The route by IV, intrathecal, and oral, and used in breast, lung, bladder, and head and neck cancer, leukemia and lymphoma, choriocarcinoma, and osteogenic sarcoma. And the adverse effects include mucositis, diarrhea, BMS, and teratogenic effect. And usually in a high dose of MTX, in order to protect the normal cells, we also give leucovorin drug, and sometimes known as leucovorin rescue. Now, the 6-mecaptopurine, it will be converted to 6-thioinosine 5' monophosphate, the TIMP, by hypoxanthine guanine phosphoribosyltransferase transferase. Okay, this TIMP will inhibit the enzyme that converts the adenine and guanine of ribonucleotides that would impair the DNA synthesis. And usually it acts at the S phase of the cell cycle, and it is given orally and used in leukemia and also in non-cancer such as Crohn's disease and ulcerative colitis. The side effects include BMS, liver toxicity, and GIT toxicity. Fludarabine and cladribine inhibit the ribonucleotide reductase and will be incorporated into DNA and cause impairment of the DNA synthesis, and they are used in lymphoma and leukemia, and the side effects include BMS, nausea, vomiting, myalgias, and arthralgias. Now, the pyrimidine antagonist, 5-fluorouracil, it inhibits the thymidylate synthase by thymineless death. It interferes with the RNA processing and the mRNA translation, and it will cell arrest in the S phase and inhibit the DNA synthesis. Usually is given by IV route and most commonly used in colorectal cancer and other solid tumors such as breast, stomach, pancreas, esophagus, liver, head and neck. And the adverse effects include nausea, mucositis, diarrhea, BMS, hand and foot syndrome, and neurotoxicity. Okay, cytarabine and capecitabine will inhibit the ribonucleotide reductase and by incorporating into DNA and impair the DNA synthesis. So, cytarabine is used in leukemia, and capecitabine used in breast cancer, colorectal cancer, GIT, liver cancer, and pancreatic cancer. And the side effects include myelosuppression, nausea, vomiting, and diarrhea. Moving on to the microtubule inhibitors, the plant alkaloids. There are beta-alkaloids and taxanes, and examples are vinblastine, vincristine, vinorelbine, paclitaxel, and docetaxel. Okay, the beta-alkaloids is a natural product originally from plant or Vinca rosea. Okay, the mechanism of action, it interferes with the chromosome segregation, especially at the mitosis of the metaphase. So it inhibits the tubulin polymerization into microtubules and lead to the cell death. So Vinca alkaloids are known to poison the microtubules. The comparison between vincristine and vinblastine. Okay, vincristine is used in childhood cancer such as neuroblastoma, ALL, Hodgkin's, Wilms tumor, and Ewing's tumor, while vinblastine is used in Hodgkin's or non-Hodgkin's lymphoma, breast cancer, and testicular cancer. Vincristine, there is marrow sparing effect, but vinblastine there will be bone marrow suppression. Vincristine, the alopecia is more common and neurotoxicity is seen, but it is less common in vinblastine, and the side effect will have constipation for vincristine and nausea, vomiting, and diarrhea in vinblastine. Okay, the taxanes is a natural product derived from the bark of the western yew tree. Okay, it acts at the microtubules by stabilizing or freezing them in the polymerized state. So there is a cell arrest at the mitosis of the metaphase, which will lead to cell death. So it is used in the ovarian, breast, lung, bladder, and head and neck cancer. The adverse effects is neurotoxicity. And now we look at the antibiotics. There's dactinomycin, or also known as actinomycin T, anthracyclines, mitomycin C, and bleomycin. The drugs for anthracyclines are doxorubicin, daunorubicin, idarubicin, epirubicin, and metozentron. Dactinomycin is isolated from Streptomyces sol bacteria. It binds to the DNA and inhibits the DNA RNA synthesis, and it is cell cycle non-specific. So it is given by IV route for 5 days and used in pediatric tumors such as rhabdomyosarcoma, Ewing sarcoma, and Wilms tumor, and germ cell tumors, and gestational trophoblastic disease. And the adverse effects include anorexia, nausea, vomiting, pancytopenia. Okay, pancytopenia is there is thrombocytopenia, anemia. Okay, and then diarrhea, glossitis, oromucosal ulcer, alopecia, and erythema. The anthracycline, also from Streptomyces, and the mechanism of action, it inhibits the topoisomerase 2. So it has high affinity binding to the DNA replication, so it blocks the DNA and the RNA synthesis, and usually it affects the G2 phase of the cell cycle. It is given by IV route and used in acute leukemia for daunorubicin and idarubicin, and for the doxorubicin and epirubicin, used in solid tumors such as breast, thyroid, ovary, bladder, and lung cancer. The adverse effects of anthracyclines is cardiotoxicity. So in the acute phase, there will be ECG changes, and in the chronic phase, there will be dilated cardiomyopathy that can be seen by X-ray or echocardiography. And also there is bone marrow suppression. Mitomycin C, also from Streptomyces, and the mechanism of action, it affects the S phase, and it activate the free radicals and generate the alkylating agent, which will cross-link the DNA and inhibit the DNA synthesis. The route is IV, and it is used in squamous cell carcinoma and bladder cancer. For bladder cancer, it is given by intravesical route, and the adverse effects is bone marrow suppression and hemolytic uremic syndrome. So this syndrome include hemolytic anemia, thrombocytopenia, renal failure, and interstitial pneumonitis. And last, antibiotics is bleomycin. Okay, it is copper chelating glycopeptides. It binds and breaks the DNA, forms the free radicals, and inhibit the DNA synthesis and act at the G2 phase. It is given by the IM, IV, and subcutaneous routes, and used in Hodgkin's and non-Hodgkin's lymphoma, head and neck cancer, squamous cell carcinoma, testicular cancer. And the adverse effect is it causes pulmonary toxicity or bleomycin lung, and mucocutaneous reaction on the skin like erythema or ulceration, and alopecia. Okay, topoisomerase inhibitors are camptothecin analogs and podophylotoxin analogs. which include topotecan, irinotecan, and etoposide. So the irinotecan and topotecan inhibit the topoisomerase 1, which act at the S phase and cell arrest at the G2 phase and given by IV route. Etoposide inhibit the topoisomerase 2 and cell arrest at the G2 phase and given by oral and IV route. So irinotecan is used in colorectal cancer, gastroesophageal cancer, and lung cancer. And it has a side effect of diarrhea, bone marrow suppression, and nausea and vomiting. Topotecan used in lung cancer and ovarian cancer. The adverse effects are nausea and vomiting and bone marrow suppression. And etoposide used in lung cancer, lymphoma, and gastric cancer. And the adverse effects are nausea, vomiting, hypotension, alopecia, and bone marrow suppression. Okay, now the hormonal drugs include glucocorticoids, the prednisolone, estrogens, ethinyl estradiol, progestin, hydroxyprogesterone, SERM, tamoxifen, toramifene, SERT, fulvestrine, aromatase inhibitors, letrozole, anastrozole, exemestane, anti-androgens flutamide, bicalutamide, 5-alpha reductase inhibitors, finasteride and dutasteride, and GnRH analogs, neferalin, triptolin, goserelin, and lucoprolide. Okay, prednisolone, the syrup will bind to the receptor proteins in the cancer cells and form the steroid receptor complex, and it will bind to the DNA. So there will be dissolution of the lymphocytes, and this will inhibit certain mesenchymal tissues. So usually prednisolone is used in leukemias or lymphomas, and to control malignancy or chemotherapy associated complications such as hypercalcemia, hemolysis due to thrombocytopenia, or increased intracranial pressure, and it has antipyretic effect and also anti-emetic effect, which will increase metoclopramide and ondansetron reaction. So ethinyl estradiol will inhibit the prostatic tissue by blocking the production of luteinizing hormone in prostatic cancer. So the adverse effects include thromboemboli, MI, strokes, hypercalcemia, gynecomastia, and impotence. Hydroxyprogesterone acetates will bind to the progesterone receptor such as in the breast and the endometrial cancer, and it is given by oral route, and it is hormonal therapy for hormone-dependent cancer treated by surgery and radiotherapy in breast cancer and endometrial cancer. And the adverse effects are irregular bleeding, amenorrhea, breast engorgement, mood swings, and long-term use of progesterone increase the risk of breast cancer. So these progestins has been replaced by aromatase inhibitors. Okay. Selective estrogen receptors modulators, SERM or tamoxifen. It is a drug that target the estrogen receptor. So this tamoxifen will compete with the natural hormones for the intracellular receptor. Okay, so it binds to the estrogen receptors, so it impairs the RNA synthesis, so there will be inactive receptor complex, and it is cell cycle non-specific, and it is given by oral route and used in breast cancer, and the adverse effects are hot flushes, nausea, vomiting, skin rashes, vaginal bleed and discharge, hypercalcemia, and it has the potential to cause endometrial cancer. Selective estrogen receptors downregulators, fulvestrine, is a pure steroidal anti-estrogen. It binds to the estrogen receptor with the affinity more than 100 times than tamoxifen, and it will reduce the number of estrogen receptor. It is given by IM route and used in postmenopausal women with anti-estrogen therapy of metastatic breast cancer, and the adverse effects are nausea, pain, hot flashes, ataxia, and headache. Aromatase inhibitors. Okay, the first one is aminoglutamide. It is the first aromatase inhibitor which block the adrenal gland, and it is non-selective, which it affects the normal cells, so it gives unfavorable side effects. So newer drugs have been developed, which is the anastrozole. So anastrozole inhibit the adrenal synthesis of androgen and estrogen, and used in early stage of breast cancer, and in tamoxifen failure of advanced breast cancer. So we can give anastrozole. The adverse effects, it cause bone loss, and patient may come with fractures or arthritic symptoms. Okay, flutamide is non-steroidal anti-androgens. It competes with the natural hormones for binding the androgen receptors. Used in prostate cancer. Okay, it will increase the luteinizing hormone and testosterone by anti-androgenic action in the pituitary. So flutamide usually administered together with luprolide, which is the GnRH analog, which will compensate the hypothalamus pituitary axis in producing the LH and testosterone level. So will also have the side effect of gynecomastia and liver failure. Okay, finasteride inhibit the 5-alpha reductase enzyme, which converts the testosterone to dihydrotestosterone in prostate cancer. It is given by oral route, and it is also used in BPH, benign prostatic hypertrophy, and the adverse effect, it decreases the libido and impotence. And GnRH analog, it act in the pituitary with initially stimulate and then followed by inhibition of the FSH and LH. It will reduce the androgens and the estrogen synthesis. So it is given by subcutaneous depot and IM. It is used in prostate cancer and premenopausal women with advanced breast cancer, and the adverse effects are impotence, hot flashes, and tumor flare.